I guess I want to start with just how are we doing? Are we in the midst of a COVID winter surge, or is there more to come?
Well, that's a very valid question, and yes, we are in the midst of a winter surge as expected, but we are not as bad as what we were exactly a year ago. But still, we are almost 70% of the huge surge which we had last time. We're having ups and downs, like we're having sometimes case loads going down, sometimes going up, but on an average, we are seeing new cases being diagnosed overall.
Okay. And you say, comparing it to last year,
yep.
The majority of the hospitalized patients last year, it seems like we saw a surge in elderly patients.
Absolutely.
Elderly deaths. Is it different this year?
Yes, because of the vaccinations, most of our patients in our community above the age of 65 are vaccinated. We're seeing a more influx of patients between the age group of 30 and 50. And that's where there also has been some vaccine reluctancy. At the same time, there are, of course, breakthrough infections as well, but cases are not as severe among the vaccinated individuals.
Would you say most of your hospitalized patients are unvaccinated?
I would say at least 85% of them. Yeah, and those who also got the infection in spite of being vaccinated either are elderly or they have some major comorbidities with hypertension, diabetes, and obesity being the top three. At the same time, people who do get vaccinated and get infection, the COVID infection, is less severe, it's short-lived, I should say, and people do not end up having to get intensive level of care.
Okay. There's a lot of talk about the Omicron variant. Is it here? And if it's not, do you see it? Will it be here? And how is it different, perhaps, than Delta?
Well, right now, as we see, half of the states have the Omicron variant. It's just going to keep multiplying as we go into the colder season. But as we see in the UK, which had more vaccine penetrance into communities, still they had a huge surge in cases. In fact, they beat the numbers compared to what they were last year as well. So yes, Omicron will be here, of course. We do not know yet if it's in the midst of our communities, because you have to probably, again, test it and do some gene sequencing, which is absolutely not always required. But at the same time, if you see a person who is vaccinated, got the booster in, is relatively younger and does not have any comorbidities, that's when practitioners and providers think about possibly Omicron variant, and that's how it's been sent out to the core labs at Pittsburgh to do some gene sequencing. But to my knowledge, we have not seen any Omicron yet. It might be still here, we don't know. But at the same time, it's more easily transmissible. But with regards to severity, what we have heard from our counterparts in South Africa as well as in the African continent, it's not very severe. But things can change if the variant penetrates into our older communities. And then probably we can see a different side of the variant. But for now, it doesn't appear to be as severe as the Delta, but at the same time, it is definitely more easily transmissible compared to Delta.
And how are the vaccinations in combating?
So recently, we already knew about the Pfizer one, that if you got your 2 shots, the effectiveness was only around 33%. But with the booster, your immunity jumps up to 25-fold, and that definitely gives you protection. Similarly, with the Moderna as well, having the 2 shots was not as effective, but if you have a booster, it can jump up more than 35 folds your antibody titers and can give you good protection. With the J&J vaccine, even though it was a one-shot series, of course, there was a booster announced, and on top of it, the effectiveness was only in the mid-60s, and that too, even without the Omicron variant. So I would urge people to get the mRNA vaccine if possible, or get a booster of an mRNA if they've already been vaccinated with the J&J.
We're hearing a lot that hospitals are, you said we're in a surge, they're at capacity or over capacity. How does that affect us in the community? Why should we be concerned if a hospital tells us they're at capacity? Yeah,
so there are multi-pronged issues with that. So we were anticipating a COVID surge, especially because of the low vaccine penetrance into our community. So we knew this was coming. On top of it, a new variant came in, which is the Omicron. And thirdly, we already have the flu now in our community, which wasn't there last year because things were shut down completely. And people were more diligent with masking, which is not happening because there's COVID fatigue. So that's definitely with the infection standpoint. We are getting a huge surge of all of these things coming in. But most importantly, we're having also non-COVID related emergencies. Like people really did not take care of their health for the last 22 months. And now people are either coming in because they are scared, like, what to anticipate. Are we going to clamp down again? Again, shutdowns might come in. Secondly, things are worsened, like, people who had heart conditions like congestive heart failure, kidney issues, they were like delaying care for fear of coming into healthcare facilities lest they would acquire the virus. So now, because of that, people have become into more serious health conditions. They're coming in more emergently into our ERs and into our hospitals. And if that continues to happen, we won't be able to provide good care for people who really need it. Like, because we can use those beds for some other legitimate reason, which is like, really of urgent nature. Not saying that, any healthcare issues are urgent in nature, but again, things which can be prevented by either taking the shots, by watching what you eat, by doing your due diligent care with your primary care doctors or a specialist. If that's done diligently, we can free up those beds for people who are urgently in need of them. So that's what capacity does to all facilities. All the specialties are strained to the limit because of these things.
Are you seeing people who may need a surgery that's not life-threatening, like I need a knee or perhaps a hip? Are they having to wait because of you're at capacity?
Absolutely, and because we want to free up those healthcare staff to treat for our inpatients already, we want to free up beds because, again, there's a post-op bed which is utilized when a person comes in. Again, like, if something is of urgent nature, which cannot wait, is being attended to, but things which can be waited upon. I had a patient who I heard, like, 3 times, like, his knee surgery was postponed, and it's been more than 18 months since he could. So he is like, it's not in a like life-threatening condition, but like that affects his lifestyle. So we are seeing those examples more and more just because of the acute nursing shortage, because people, either the staff is quarantined, they are sick themselves, or just because of the huge capacity issues where we cannot maintain a good, healthy nursing to patient ratios. So to avoid that or to help mitigate that crisis, certain non-urgent procedures are being postponed.
So the holidays are approaching, Christmas, and people go out and get together in bars and places on New Year's Eve. What is your advice? Can we still celebrate safely, and how so?
I think so. We can, and hopefully, like, we continue with the milder surge of the winter of the cold right now. So if that happens, like, I think improved ventilation is the key. Even if you're gathering somewhere, like, keep a sliver of window open, keep some portable fans open to increase aeration, and try to keep a distance, especially among people who are not your immediate family members or you don't know their vaccine status. Whenever possible, like, keep a mask on and, like, bring it down for sipping and for eating. Put it back on. Like, you don't need to keep it down for 20 minutes while you're eating. Take a morsel of food, cover yourself up. And most importantly, vaccinations. Get the flu shot, get the COVID shot, get the booster if applicable. And again, social mitigation strategies will definitely go a long way. If in doubt, like, always wear a mask, because that's going to be a best defense against Omicron and also other future variants. And if you are going to be in a group who probably cannot take the vaccine because of allergy issues, because of their comorbidities, try to have probably a virtual session with them. Try to celebrate the holidays virtually, especially if you have people are immunocompromised, because as we know, people who are vaccinated, but if you have a bad immunocompromising condition, they can still get infected. So, like, being selfless, thinking about your family and community members will go a long way during this holiday season. And that's what I keep watching the weather report, and one might think, why is an infectious disease doctor watching the weather report? Because the colder it gets, more people are huddled indoors, they crank up the heat, humidity goes down. That's what the virus likes. It thrives in dry conditions, especially with the humidity being down.
You talk about the importance of vaccinations. Or the rate in our area, is it still climbing, or have we kind of leveled off as far as vaccinations?
Unfortunately, we are largely leveled off. Like, we are still stuck around in the 50s. We would like it to be more, but like, I think the people who really wanted it and who were persuaded to get the vaccine, they did get the vaccine, but there's still a lot of work to do to get the other population in.
So, would you be able to address some of the misconceptions about the vaccine as far as affecting fertility and things like that? Are these misconceptions?
Oh, absolutely, because these mRNA vaccines are not really a new mechanism. They have been worked upon even for the Ebola virus in the past. There was work being done against adenoviral infections. So these are like one of the most safest vaccines we can ever have because they don't last for too long. Once the genetic information is passed on to the human immune cells, they are destroyed very quickly. And almost after 2 weeks, none of them is left in your system. And second of all, this is an mRNA vaccine. Like, all of our human cells are DNA. So absolutely it cannot get incorporated into your DNA. So it can never, ever affect your fertility. The second misconception I hear is about it's being made from aborted fetal cells. And that, again, is a myth. There is no proof that that's what's been made from. And thirdly is it is not going to cause you to have cancers because, again, it does not get incorporated into the human DNA. And it only does it trains your immune cells to fight the infection when it comes knocking on your door.
So you're saying this technology is not new?
It's not new. It's been there about, and that's the reason why so quickly, within a span of 11 months, the first vaccine could be out there. And people might be thinking, well, shortcuts were made, but no, not at all. Because we knew this information was available and we wanted something faster, we had to do it. And world over, millions and millions of doses have been given out. And the only way to stop this virus once and for all is through vaccines.
How about testing? How important is that? Yesterday, Biden announced that he's going to authorize 500 million tests for free to people that want them, the at-home tests. How important is testing on that scale?
Yeah, absolutely. I know sometimes you might think that, it's not necessary to test, but at least testing would give you the ammunition to either protect yourself as well as your close family members. And with Omicron and probably future variants, probably the incubation period, which means that the time of exposure to time of positivity is going down. And if you have the right information, you can really help stomp out this crisis by quarantining yourself if your health permits you to do so. And secondly, we are seeing a very high degree of sensitivity with the home tests. And we have seen that in many of my patients when it's confirmed with a regular test, and it comes up to be pretty same, almost the difference of maybe 0.1 to 0.5%. But we are seeing a high degree of sensitivity, and I think that's the best way to get along with this.
If I take a home test and I test positive, what is the isolation recommendations now? Have they changed or?
Well, not as of now, but the CDC announced that things might be changing pretty soon. But as for now, from the WHO and per the old CDC guidelines and from the Infectious Disease Society of America, it still stays the same, of around an average of 10 days from the time of symptom onset. If your health is okay and you have mild symptoms, for more severe symptoms, it's 14 days. And of course, for somebody who's hospitalized and got severe organ damage, it's around 20 days of isolation. But obviously, if you're in the hospital, you're there for a reason. And the sicker you are, the longer would be the quarantine period.
Can you address some of the misconceptions about treatments? I hear a lot of talk about HCQ and Ivermectin.
Yeah, so HCQ was easy because HCQ won't even affect the virus unless they are lysed into the lysosomes, which are a part of the immune system. And again, it's going to be killed once you get into a lysosome. So again, to give you a short answer, hydroxychloroquine won't work against this virus. It's been extensively studied. They're going to be introducing a lot of side effects. Now, people might argue about Ivermectin, and there are certain countries all across the world, especially in the developing world, where they have found some proof with regards to the use of Ivermectin. Over here, in fact, even in my own practice, we have seen a couple of patients getting into the ICU for seizures, which is a bad side effect of Ivermectin use. There have been cases where veterinary medicine ivermectin is being used by humans by getting hands on them. Again, it's fraught with risk, excuse me, and we do not have the real study behind it that it really works. But all we can say so far is it really has a lot of side effects. And we have many other opportunities for treatment, monoclonal antibodies per se, which really go a long way in trying to combat this. So try the safe, trusted, and scientific methods of treatment as prescribed by a healthcare professional rather than experimenting with these drugs.
Okay. Just have one more question. We're heading into a new year. What are your hopes for the community and the health of the community in the new year, and what could we do to have a good year next year?
Yeah, first of all, everybody needs to be conscious about their own health, but most importantly about their own community members. Try to safely distance yourself from people who you think are immunocompromised, and or if you are sick, there's always going to be another Christmas, another New Year's, but life lost is lost forever. So I would say be responsible, get the vaccines in as quickly as possible. There's still some time before the real cold weather sets in. And second of all, take care of your own self, eating in moderation, exercising, hydrating yourself well, and trying to keep yourself fit and healthy so that you do not get sick, you do not get admitted to the hospital for any other non-COVID reasons, so that you can help the capacity issues of the hospital as well. And lastly is whenever in doubt, it's always good to err on the side of caution. If you have a scratchy throat, if you have symptoms of sinus infection, or you might just think, well, it's just some old stuff which you get yourself tested. If you can't get tested, assume you probably have the infection and try to self-quarantine to as much extent as possible if your health permits you to do so. Of course, if you fall sick, call your healthcare provider and then decide to come into the hospital if your medical condition precludes you from doing so.
Okay. Yeah. Is there anything I didn't ask you want to?
I just think lastly, just be safe, be responsible, and let's all have a blessed year. But I think there will be eventually a light at the end of the tunnel, but at least for a year and a half, we need to pull up our socks and fight this. As the time passes by, I think this particular infection is going to become endemic, like the flu, and we'll have seasonal variations. Like in the fall months, winter months, we'll get a higher trend. But to achieve that, we'll have to work right now so that we all can have a safe and a healthier future. So next year and a half is going to decide which direction we are heading into.